patients should check the sugar once in a while, once in 6 months or something, because some patients, they may be asymptomatic, most of the patients.
Is one thing that people are scared about. Maybe in this World Diabetes Month, this is a point I think we should trust more. Before we end this session, Dr. George, what will be the take-home message you would try to put up to the crowd on this World Diabetes Month?
When I see a patient, I would always advise him, if I see that the sugars are high, you just try to give him some positive reinforcements. You just tell him that this is not the end of the day.
Very good.
So basically,
Excellent.
before making him embark on a journey of drugs, I would stress on lifestyle modification, like we said, we discussed this in detail. Still the importance of sleep, stress management, etc. Before you actually, provide him with a chart regarding the drugs that he can opt for.
I think that is one point all of us can practice. The first note that we do not impart on medications but on lifestyle modifications, just manage at the first line.
And more importantly, I think we should have an open communication with the patient, like which is lacking in the practice.
In the previous talk, mention also was looking at very important that
Very, very important.
very important.
One more point I want to add is that if patients should check the sugar once in a while, once in 6 months or something, because some patients, they may be asymptomatic, most of the patients. Some patients will be having some dry skin or something like that complaint. Some patients skin sores or early skin sores. Some patients polyuria, means passing lot of urine. Some polyphagia, craving for food or thirsty. Such symptoms are also related to diabetes, more chance. So they should check the blood sugar once in a while, once in 6 months. If they are not diabetic,
If you are not diabetic,
even if you are not diabetic, they have to check.
say once in 6 months,
Why don't we just not check sugar? We check sugar, we check the HbA1c, and once in 6 months, there is no harm in going for a cholesterol workup as well.
exactly, because obesity is common now. So I think once in 6 months, a checkup of blood sugar, HbA1c, cholesterol, kidney function, liver function, and hemoglobin. I think maybe nowadays vitamin D and B12 also not to ignore.
Some patients will be having this fatigue. They may think that this fatigue is due to their work-related issue, not a medical condition. Most probably, they can be related to diabetes.
Fatigue is one of the most common symptoms of diabetes. Absolutely fine.
Everyone miss, even the patient and doctor may sometimes miss the fatigue.
Yeah, fatigue. True, fatigue is one.
But we just ignore. Yeah, all of us ignore. True. And Dr. Raj, what do you think? Your take-home message?
First of all, I want to remove this myth that taking medicine is harmful. Because lots of people are saying, if I will start taking medicine, I will be like, it will harm, it has a side effect, it will harm us. No, diabetes is more harmful than any other side effect.
Yeah, because first question they ask us, can this medicine cause kidney disease?
Yeah, diabetes is harmful to each and every part of your body, a major part at least.
Yeah.
So, consult your doctor, be on time, do exercise, as Dr. George and all of us agreed that do exercise, your diet, and consult the doctor. If required, take the medicine as advised.
Very good. I think that point adds to the 4 pillars in the management of diabetes, if I'm not wrong. Look at the 4 pillars. So if I have to say something now, 4 pillars: 1, diet; 2, exercise; 3, stress management; and 4, drugs. So drugs are also there. So only if all the 4 is strong, you can build a good structure.
Exactly.
So this thing, we should not be keeping away from doctors. We should not be keeping away from medicines. If necessary, as Dr. George was mentioning, let us not take it as the first choice.
Exactly.
After the diet, after the exercise, after the stress and sleep management, everything is fit. Why should we scare about adding a drug? So on the 4 pillars, let us build a very healthy world, so that these numbers of millions that are going to come up, we can prevent them earlier. And if at all we can prevent complication.
Can you say regarding if this diabetes reversible or not? Most of the patients are having reversible or not.
That is one thing that people are scared about. Maybe in this World Diabetes Month, this is a point I think we should trust more.
Dr. Rahul, can you just shed some light on that factor?
Yeah, reversibility of diabetes. Now, there was a time when diabetes was never considered curable. Now, we are not using the word curable, but caution, but with confidence, we are saying diabetes is reversible. Reversibility means you are able to bring back the HbA1c below 6.5. Okay. Now, when you are bringing back to below 6.5, you are literally reverting diabetes, though you are not curing. But I would say this is a big light of confidence to people that yes, we are reverting diabetes. But one point is also there. It should not be taken as too much of overconfidence that once you are below 6.5 HbA1c or once you have reverted diabetes, do not give up your lifestyle, your diet, your any bias, or even if you are on a medicine, please do not. And Naufal, I will add one more point. Can we stop medicines? That's one question that people ask. Yeah, if you are bringing it down to below 5.7 and you are saying that your sugars are well normal, but still you are diabetic reverted. Okay, it's not like diabetic cured, but keep an eye on your numbers as well.
Are there any patients you have personal experience with?
Honestly speaking, yes, Nopal. If you ask me, I do have quite good number of patients. I'm not saying that I'm into stopping medications, but yes, I have a quite good number of patients, expats and nationalites who have done extremely good changes in their diet lifestyles and brought back diabetes, reverted, and then brought down even below 5.7. And they have even stopped medicines and maintaining it below 5.7. I like to mention the slogan for the Diabetes Day, 14th November, where WHO celebrate. You know what they say this time? This for 2025, they say diabetes across all states. So what is the intent is that all of us, all the people in diabetes or all people in the world must have accessibility to the nearest healthcare so that they can check their sugars, they can get them treated, they can get accessibility, they would have a knowledge about the disease. So that should be the that is what the WHO on for the 14th November 2025 has mentioned as their statement. So Dr. Taj.
This month, IDF, that is International Diabetic Federation, and WHO has given a slogan that do no more and do more for diabetes accord. Like that, you should know your diabetes, you should manage it in the workplace with the stress what we have discussed, and that work and life balance.
Adding to that, let us not forget regarding the lifestyle modification, diet modification, exercise, sleep, stress as well. We should keep all this in mind.
So diabetes and your well-being would be the bottom line message for today. Stay healthy. Thank you.